Hi, my name is Alejandra Garcia, and I will be discussing what schizophrenia is. If you're having trouble understanding the concept, keep watching. What is schizophrenia? Schizophrenia is a psychological disorder that consists of major disturbances in thought, perception, emotion, and behavior. Schizophrenia is considered a psychotic disorder, which means a person's thoughts, perceptions, and behaviors are reduced to where they can't function normally. A common misunderstanding is that schizophrenia is the same as a multiple personality disorder. However, that is not the case. The main symptoms of schizophrenia are hallucinations, delusions, disorganized thinking, disorganized or abnormal motor behavior, and negative symptoms. There are several types of hallucinations. There are auditory, visual, and olfactory hallucinations. There are also different types of delusions. There are paranoid, grandiose, and somatic delusions. How is schizophrenia diagnosed? Diagnosing involves identifying people who show symptoms of unusual thought content, paranoia, odd communication, delusions, problems at school or work, and a decline in social functioning. Following these individuals over a period of time can help in diagnosing. Causes of schizophrenia are seen from genes, neurotransmitters, brain anatomy, and marijuana use. The risk of developing schizophrenia is nearly 6 times greater if a parent has schizophrenia, and although it is in genes alone are not enough to cause schizophrenia. An overabundance of dopamine or too many dopamine receptors are responsible for the onset and maintenance of schizophrenia. Serotonin has also been seen as a cause, and medications are used to block serotonin receptors. Brain imaging has revealed that people with schizophrenia have enlarged ventricles. Larger ventricles cause several regions of the brain to be reduced in size, meaning that schizophrenia is associated with a loss of brain tissue. People with schizophrenia also display a reduction in gray matter in the frontal lobe, which the frontal lobe is responsible for decision making. Marijuana use is a risk factor for schizophrenia. However, it is not essential or high risk since not all people with schizophrenia have used marijuana, and most of marijuana users do not develop schizophrenia. If used at a young age, marijuana does disrupt normal brain development and can lead to schizophrenia if vulnerable. Treatment for schizophrenia: there are typical and atypical antipsychotic medications. These prescription drugs can reduce abnormal thinking, hallucinations, and delusions to regulate dopamine levels. And cognitive behavioral therapy helps people learn how to test the reality of their thoughts and better manage symptoms. Who is at risk for schizophrenia? About 1% of the population experience schizophrenia, and the disorder is first diagnosed during early adulthood. Symptoms usually start between ages 16 and 30. Schizophrenia rarely starts during childhood or after age 45. The chances of a man or a woman of any ethnic group are equal to get schizophrenia. It tends to begin earlier in men than in women, and people with schizophrenia or other psychotic disorders and their family may be more likely to be diagnosed with it.